If you have ever had a pelvic ultrasound scan and you expected the sonographer to tell you whether your tubes are blocked, this video is for you. Come to the front seat. If you have ever asked that question before, you are definitely not alone. In fact, it is one of the most common questions I get during a routine pelvic scan. During a routine pelvic scan, patients always ask, are my fallopian tubes okay? It is a very reasonable question, especially for women who are trying to conceive. But here is something many women don't know. A pelvic ultrasound scan usually cannot tell whether your fallopian tubes are blocked. Let us talk about why. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. In today's video, I'm going to explain why we can't give you information about your fallopian tubes on ultrasound. But before we continue, if you are a TTC mom and you are tired of guessing, you are tired of tapping for the blessings of childbirth under people's comment section, you are ready to take action, all you have to do is click the link in my bio and join the community of TTC mothers. I will be launching something very profound in the coming weeks. You don't want to miss it. Now back to our video. First of all, let us understand what the fallopian tubes actually do. The fallopian tubes are two thin tubes that connect the ovaries to the uterus. Every month after ovulation, they pick up the egg released by the ovary. If the sperm meets the egg inside the tubes, fertilization happens there, and the resulting embryo then travels into the uterus for implantation through the fallopian tubes. So yes, a healthy fallopian tubes are very important for natural pregnancy. A routine pelvic ultrasound cannot always tell whether your fallopian tubes are blocked or not, and you might be wondering why. This is because the normal fallopian tubes are incredibly tiny. They are usually collapsed when they are empty. So on ultrasound, they often blend with the surrounding tissue and they are not visible. So if your sonographer says, I cannot see your fallopian tubes, it doesn't mean something is wrong. In most cases, that is actually the normal finding. We don't see the fallopian tubes during a routine pelvic scan. But wait, you might ask, can ultrasound ever see the fallopian tubes? The answer is yes, it can, but usually when something is abnormal. For example, if a tube becomes filled with fluid, a condition called hydrosalpinx, it becomes enlarged and much easier to see on ultrasound. The same thing can happen if the tubes are filled with pus from an infection called pyosalpinx or blood known as hematosalpinx. These are all abnormal conditions, and that is when we see the fallopian tubes on ultrasound. However, even if you can see the tubes on ultrasound during these abnormal conditions, ultrasound alone cannot reliably tell us whether it is open or blocked. So if ultrasound cannot confirm a blocked tube, what test can? The most important test and the most common test is called HSG, which stands for hysterosalpingiography. It is an X-ray procedure. During this procedure, a special dye is gently introduced into the uterus, and X-ray images are taken to see whether the dye flows freely through the fallopian tubes. If the dye spills at the end of the tubes, then it is an indication that the tubes are open. If it doesn't, it indicates a blockage. Another option is sono HSG. This one uses ultrasound, but not the routine pelvic ultrasound. It is a special type of ultrasound. It is used together with a special contrast fluid to check whether the tubes are open. So yes, there are tests that are specifically designed to assess the fallopian tubes, but a routine pelvic ultrasound is not one of them. The only way we can see the tubes on ultrasound is one, if you're doing a special kind of ultrasound called sono HSG, or if there's an abnormal fluid collection in the fallopian tubes. That said, ultrasound can still provide valuable clues. For example, if we see a hydrosalpinx or signs of previous pelvic inflammatory disease or severe pelvic adhesions, we may suspect a tubal disease. But these findings do not confirm that the tubes are blocked. So the next time you are having a pelvic ultrasound scan and you are wondering whether your tubes are open, know that a routine pelvic ultrasound is excellent for only assessing the uterus, the ovaries, and many pelvic conditions, but it is not the test used to determine whether the fallopian tubes are blocked or open. If you're being investigated for infertility or there are concerns about your tubes, your doctor will recommend a HSG examination or any other specialized test. I hope this clears up one of the most common questions I hear in the scan room. If you found this video helpful, don't forget to like, share and subscribe, and share it with someone who might be trying to understand their fertility journey. If you have any more question or confusion or experience you would like to share, feel free to leave them in the comment section and I might just cover them in the next video. I will see you in my next video.